And now we have open evidence, and you can just toss anything in and find out all the medical research and papers.
I just learned about open evidence. That's so cool. It's like a ChatGPT for doctors.
Something really unusual is going on with my daughter, Tanya, and I'd love for you to help me figure it out. And I thought, well, you're a pediatrician at a major university in Los Angeles with access to all the experts. Why do you want to drive an hour to see me? And she said, no one believes me. And when I talk to some ENTs, they will say, even if the tonsils look okay on the outside, when we do take them out, there's so much infection hidden under there that we didn't realize, and it's so close to the brain. Could that be why it's feeding this inflammation in the brain?
Welcome to Look for the Helpers, a podcast by Engage Therapy in Agora Hills, California. Hosted by Adelina Brisbois, licensed marriage and family therapist, and her husband, Dr. Blake Brisbois, licensed psychologist. Thanks for being here.
Okay, so hi, Tanya. Welcome. Thanks for joining me.
Thank you for having me.
I'm excited to introduce you to our audience. This is Dr. Tanya Altmann. She's a pediatrician with Calabasas Pediatrics in Calabasas, a mom and a book author, and a really good friend of ours, an expert in the things that we don't know. We always call you to help, figure out, problem solve. I know recently they closed Los Robles pediatric unit, and the first person I thought to call was you. What do we do, Tanya? How do we handle this in the future? Let's be prepared. And you're right there for us to think about together and have a plan for the clients that we see. So we're very appreciative for your time and joining us today and to share your knowledge with our audience. So we have a lot to talk about. I don't know if you want to share a little bit about yourself in terms of, your background and how you feel like your pediatric experience relates to mental health and what you've seen in your time.
Sure. Well, thank you for having me today. And I love our community and how collaborative we are as well, because I often need mental health professional ideas and brainstorming and help with my own families, since it all goes together. So I trained at UCLA, and I've been practicing pediatrics in the community here for 25 years. For the first 15 years, I was in a more traditional insurance-based practice where I was really lucky to practice with some older, very wise pediatricians that really thought outside the box. And that's what I love about general pediatrics, is that every child doesn't fit into a protocol. And every week we were getting cases that we really had to sit and brainstorm and think about and figure out, what can we try that's different to help this family? And then 10 years ago, when I had my third, I have 3 boys, and there's a fairly big age gap there. They're 20, 18, and 10 right now. So 10 years ago, I decided I wanted to jump out of the insurance-based system where instead of spending 15 minutes with a family, I could spend an hour or 2 with them to really delve more deeply into complex situations and preventive health and work on nutrition and sleep and, more mental health, wellness, and school success as well. And that's when I opened Calabasas Pediatric Wellness Center, which is a concierge practice where we really do take that extra time with families and keep the practice smaller. Mm-hmm. So that's sort of how I've evolved. I also, over the last 10 years, got trained in integrative pediatrics, because I feel like pediatrics is so much more than just ear infections, right? Kids today are stressed, they are overtired, they're not getting proper nutrition. The families also need help and counseling to really figure out what is going on with their kids. And we also see new things every day. And I think that's one of the things we're going to talk about today. But I'm seeing more kids with anxiety and autism and PANS or PANDAS and mental health issues, or just recurrent infections, more autoimmune issues, more obesity, things that we didn't see as much of 25 years ago. And I find that all takes more time to really be able to best help my families.
Well, yeah, you have to dive deep and kind of try to understand when this started, and it's like a puzzle, right? You're trying to,
it is.
Mystery.
And that's what's so fascinating and also exciting about it, and why I love general pediatrics, is that you really get to help work with parents to put these complex puzzle pieces together and figure out the best solution or treatment plan for the kids.
Right, because you have to work together. The parents have information and you have information. And if you put that information together, maybe you get somewhere new. This is what I love this about you, that you're not afraid to explore, think outside the box. I didn't realize, so you were trained with people who were willing to think outside the box. And that
I was, even though we
inspired-
didn't have time and we were super busy back then, we would still meet after work and discuss the unusual cases. And, and this was also when I trained at UCLA and when I was first practicing, we didn't have super easy access to the internet. The charts were still paper.
Right.
And so it really took collaboration and discussions and going to libraries and pulling old papers and studies and looking stuff up to sometimes figure out the cases that we were faced with.
Probably took a lot more time than
It
it
did.
does today. Yeah, you could just look it up now.
Yeah, now we have open evidence and you can just
Yeah.
toss anything in and find out all the medical research and papers.
I just learned about open evidence. That's so cool. It's like a chat GPT for doctors. Is
It
that
is,
correct?
and it can pull all the studies. So I'll say, find me all the research papers on a child that has strep throat and sudden onset OCD or something like that, whatever is going on.
And then you can do your own research. It's like you have access to your own research. You can read those papers and deduce what you want from that.
Exactly. I don't have to drive all the way to UCLA anymore and go to their medical library, which has shrunk in size over the years.
Sure, because
too.
of this, probably.
Yes.
So speaking of which, we work with kids. We've worked with kids for a long time. And actually, before we had kids, you taught us about PANS and PANDAS. I don't know if you remember that. You did like an in-service where we were working, and I remember learning about it and thinking, oh man, that's really an intense thing that would happen to somebody. And then it was close to our hearts. It kind of came really close to our family. And so and some friends. And so I started to dive really deep into learning more about it. And you taught me the most about it. And you put me in touch with amazing referrals and resources of places that know more. So I'd love for you to just chat a little bit about that, because I think there's a lot of families and clinicians that could know a little bit more about it.
Definitely. And, I don't think I'm by any means an expert, but I always say when families come to me with new things that I don't know, I will be your partner in helping you figure this out, because that's what my role is as a general pediatrician. Now, talking about my old practice in Westlake Village with the amazing mentors I had, I remember even back then having a child come in with strep throat who seemed to get better and then all of a sudden came back in with OCD and tics and really acting crazy and still had a sore throat. We rechecked, it was still again strep. And so we retreated them with a more broad spectrum antibiotic and they got better. And that was one of those interesting cases that we all met about after work to talk about.
Because it didn't fit into a box.
It didn't fit into a box. And that was sort of my first hey, is there something here going on? And then as the years went on, we really would see more cases. And I remember another case I had, a pediatrician called me up and said, something really unusual is going on with my daughter, Tanya, and I'd love for you to help me figure it out. And I thought, well, you're a pediatrician at a major university in Los Angeles with access to all the experts. Why do you want to drive an hour to see me? And she said, no one believes me. And I'd like to tell you my daughter's story and see if you can help me put the pieces together. And her story was, her child was 3 and caught chickenpox, had one vaccine at age 1, as we usually do, but wasn't old enough yet to get the second.
Okay.
So she caught chickenpox and immediately went into this spiral where she started having separation anxiety and OCD and tics, and her handwriting deteriorated and her behavior deteriorated. And we went on this journey where we really delved into research around the country and realized that Dr. Sue Suedo had recognized PANDAS and PANS as an actual disease state back in the late 90s at the NIH and done a lot of research more specifically with strep. And so what PANDAS is, it is a pediatric autoimmune neuropsychiatric disorder associated with strep. And PANS is pediatric acute onset neuropsychiatric syndrome. And essentially what it is a child will get an infection. And then anywhere from days to weeks or even months later, as their body is mounting an antibody response to help get rid of that infection, it somehow attacks their brain, specifically the basal ganglia. And they really kind of turn psychotic even overnight. And they can have
Which can be so scary.
It is
for parents.
so scary, so scary. And when you know your patients well or your kids well and you see this change, it's like, this isn't my child anymore.
Right.
This isn't my patient anymore. And the most common presentation would be a child has strep throat, and then 3 to 6 weeks later, but it can vary, they will start having OCD and tics and behavioral changes and separation anxiety and frequent urination, especially at night, and even sometimes psychosis.
Yeah.
And we've been seeing more and more cases over the last 25 years that I've been practicing.
Really?
To now where I really see it as a general pediatric disorder. And so I like to teach general pediatricians about it and how to recognize it and to be able to start treatment, even if they then do need to refer out to centers and hospitals like UCLA and bring therapists in. And I find it's both a medical and a psychiatric treatment. So ultimately, the goal is to find that underlying cause if you can and treat that. But then there is also a mental health aspect.
Right.
The other thing I want to say, which I think is really important, is over the last 5 years, we have seen skyrocketing cases of PANS and PANDAS from mycoplasma pneumonia. And sometimes these are kids as young as preschool where they just have a runny nose and a cough all year long, because preschoolers have runny noses and coughs all year long.
Is that the one that's called walking pneumonia?
Exactly,
Okay.
walking pneumonia. Unless you do a specific test for it, which now we can do a nasal swab test for it or a throat swab, whereas years ago it took a blood test to actually look to diagnose it. Sometimes you can hear it on exam, but not always. And it's a little less clear because kids that age are constantly sick, right?
They're always snotty.
Exactly.
Especially if they go to school or daycare.
Exactly. And so sometimes it takes that detective work when parents say, my child changed overnight, or they started having sudden onset tics. And there's a neurologist at Cedars-Sinai who has been extremely helpful with my patients, Dr. Jane Taviev. And then there's also a rheumatologist at UCLA, Dr. Patrick Whalen, and other experts in the community. And sometimes I even have to go out of state to Arizona or back east sometimes to get help. But I've learned from every single conference I've been doing, every single expert I've talked to about how to help these patients.
Yeah, it's really complicated. I think people, when their kids change overnight in their behavior, I think people go to blaming either themselves or the kids. Like it's like they're doing this on purpose because last week you could handle this, and now all of a sudden you can't. So I think it's true. I've heard a lot of people just not being believed, because it doesn't really make sense, and that's part of what I think is so scary about this, which is why I want more people to know about it.
Yeah, and the other thing I think medicine is so great that we do know so much, but new things pop up that we don't know yet. And during those 10 to 20 years where the research is evolving and the treatment plans are evolving, a lot of people seem to call things controversial, or we don't know what to do, or younger pediatricians might be scared to treat it, when as long as it's not dangerous, alternative, really wacky therapies, like, your job as a pediatrician, it's more of an art than a science sometimes to really look at all the tools we have. So if children have, recurrent symptoms of mycoplasma pneumonia, or they have high titers on blood work or strep or varicella or anything else, and the history is clearly there, then you do need to take a step back and look kind of at that underlying treatment. So for example, we use a lot of Zithromax initially in these kids because it tends to cover mycoplasma and strep pretty well, but also it has an anti-inflammatory component. And while some of the component is treating the underlying infection, there's also decreasing all this inflammation in the brain.
Right, which is the basal ganglia. That's why we see the change in behavior and the potential psychosis and dysgraphia, right?
Exactly. And so that's why anti-inflammatories can also play a role. So whether it's ibuprofen, or there's been some research that Aleve, actually, naproxen can work better than ibuprofen in kids, but I find a lot of my patients don't tolerate Aleve as well as ibuprofen. Okay. And it's also so specific. So I have so many kids that respond well to ibuprofen. So we will start them on the Zithromax and the ibuprofen and see how they do, while we also work on nutrition and supplements and meditation and mindfulness, and find them a therapist or psychiatrist. And sometimes we have to even bring in those medications as well, depending on how severe these kids are. I mean, I think one of the hardest things about PANS and PANDAS is that you have a percentage of kids that are very severe, and that's what's so scary about it. And those may even need to go on to getting IVIG or other serious treatments.
Like it's a longer trajectory for some kids.
But there are some that, if you catch them early and they're young, they can be treated very quickly with weeks or months of antibiotics, anti-inflammatories, and therapy. And you don't really know until you start. So often when pediatricians call me, and one called me from the city last week to say, hey, I need your advice. I have this case that I think could be PANS or PANDAS. It was after mycoplasma. Or strep, I forget, because I hear from pediatricians on a weekly basis. And while I'm waiting to get into UCLA in a few months, what should I do? And the patient got better, so much better after 2 weeks of the Zithromax and the ibuprofen and the magnesium and the omegas and all the other tools that we use. And she was so thankful. And I love that, because I think the goal is like hitting them hard with everything to see if they get better.
Right.
And lifestyle plays a big role too. So a lot of these kids are overscheduled. They're not getting enough sleep. They're eating too much junk.
Yeah, their nervous system is already high. And then now we have this biological change, and it's making it worse for them.
Yeah, it's on overdrive. So it's like, okay, let's cut out a lot of these activities. Let's try to get rid of screens. Let's try to get them outdoors, more in nature. Let's try to do these calming, regular bedtime routines. Let's really look at their diet and nutrition and focus on the protein and the healthy fats and the antioxidants and the fruits and vegetables. And, I use a lot of supplements too, in that realm as well, which I feel helps, some don't, but I do think those can also help, because I find that kids can't eat enough of that often on their own. And a lot of these kids also, if we do poke them, and I don't poke all these kids because I really don't like poking kids.
And
I don't
especially if they're in a heightened state, it might be really hard.
Yes, exactly. But if we do have to get blood work, I often check a ferritin and vitamin D level as well, because I find that low ferritin, which so many kids nowadays have, which is a better indicator, I think, of low hemoglobin when you're looking for anemia. And just getting that ferritin up can often help them with sleep.
Right.
It can help them with behavior. It can help them get sick less often. And then vitamin D as well. Too many kids nowadays have low vitamin D, and that can also play a role, whether it's allergies or whatever is going on. We want to get their vitamin D level optimized. But we also have to be careful, because you can't overdose on vitamin D because it's fat soluble.
And does all of that helps with inflammation?
It
right?
does.
So
it does.
It kind of doesn't hurt. So this is my question. The stakes seem pretty low in the treatment of it, right? Like antibiotics, omegas, magnesium, vitamin D. What's the harm?
So, I would say that I don't love putting kids on antibiotics long term, especially sometimes when we don't know if they need it, because it is going to mess with their gut microbiome, which I think is so important. And probably one of the reasons that we're seeing so many more of these issues in kids now is because we know that babies aren't born with that bifidobacteria level that they need. A recent study, My Baby Biome, showed that 9 out of 10 kids in the U.S. weren't born with the important infant-specific bifidobacteria, infantis, and others that babies need. And that's why we're seeing more autoimmune issues, inflammation, obesity, diabetes, allergies, whatever it is. And so in my patients that are totally healthy, I try to correct that at birth.
Right
and
away.
So I'm really big on the right probiotics, the right nutrition, the right lifestyle changes for your babies early on. And that's actually my next book I'm working on.
Oh, yeah?
It's going to be a longevity and wellness book for infants. And kids
cool.
of all ages. And so hopefully I'll come back on when that's available in the next year.
That would be
and
great.
tell you more about that. But my goal is preventing all of this, which I do in half my families. And then the other half of the families, I am trying to figure out why their kids have these unusual things that we need to, work on and help them with.
Because you don't always get people at the baby time, right?
Exactly.
And sometimes when you know all this information, it's still hard to do it all. So, my generation, when I grew up, I was on antibiotics all the time. And I think it did mess up my gut, actually. So I totally understand why we don't want to overprescribe that. I don't like to give that to my kids either. But in this case, when the symptoms are so bad and the situation is really scary, then it feels like of the medication to give, that feels like a less scary option.
And I agree with you. And I just had a conversation yesterday with a specialist, because I have a patient who's been on Zithromax for 1.5 years.
Oh, wow. That
due
is
to
a long time.
mycoplasma PANS. But on Zithromax, he is an essentially normal child, and he's doing amazing. But he's so sensitive to Zithromax that as soon as we wean him off, he basically turns psychotic again. And it's so interesting.
That's so hard.
And so the question is how long can he be on this? And of course, we're also supporting the gut and the rest of his body, and he's doing everything great. But if we miss 2 days in a row, he is having his tics and his OCD and waking up at night again. and having what he calls brain episodes during the day at school where he says, and what's interesting to me is little kids with PANS and PANDAS, they tend to just act crazy and psychotic. But the older kids, the ones that are 9, 10, 11, 12, especially the ones that are very smart, they can describe what's going on. And they will say things like, my brain feels like it is jumping around in my head trying to get out. Or I have a nest of bees in my head trying to buzz and poke themselves out. Or there's something in my body that needs to get out. Make it stop happening. And they're jumping up and down, trying to get it out of their body. And it's just so
that's how the little
heartbreaking
kids
to
feel.
me.
They just don't have the words.
Exactly. And it's so heartbreaking to me. And so sad, but also interesting to really hear them describing it. Like they'll come home from school and they'll say, I had 3 brain episodes today. One was 2 minutes when I was taking my test at school. One was during recess when I was playing this. And they can literally describe it to you. And then they'll say, like, I haven't had a brain episode for a few weeks. I'm so glad. Do you think it's gone? Or when am I going to be able to stop taking these medications and supplements? But yes, if it's helping, we usually tend to continue it. Now, there are kids where nothing helps, and then I'm referring them to specialists, and we are doing stronger things like IVIG. Mm-hmm. Another area that I'm learning about now are herbal supplements, and that's something that I really don't know much about, but a lot of herbals can act as antimicrobials and also maybe be helpful in addition to the antibiotics. So that's something that I'm trying to learn more about, because when I've sent patients to specialists, they come back sometimes on antimicrobials that are helping. I'm sorry, on herbs that are helping.
Like preventative for the next infection, or still trying to get rid of the infection that is already existing? Or both?
It's a good question. And it could be both. Again, I'm learning more about this. And again, this goes back to like ancient medicine, right?
Yeah.
And some of the plant therapies and things that.
I wonder about that.
Yeah. And again, it's an area I don't know about, but I'm willing to learn. When I have patients on it, I look it up and I see, this combination of herbs, which seem safe and aren't dangerous anyway, may help decrease mycoplasma levels or strep levels or, whatever it is going on. And in the case of the varicella, it was antivirals that helped. And in fact,
I was going to ask about that, because
she improved so much from an antiviral that we actually started a study on giving kids with tics acyclovir, an antiviral, to see if it helped. And it helped in about half of the cases.
Really?
Now, we ended up, not finishing the study because we were doing other things and it wasn't helping everyone. And, there's also reasons not to give kids antivirals if we don't know, since there are some tics that are self-limiting and will get better on their own. But I do feel that the basis for a lot of tics in kids is infectious. And I think we need to learn more about that.
And I think a lot of people are not looking at it like that, because for us as mental health clinicians, we get the behavior piece. We get the kids that are coming to us because the parents are wanting us to help with that piece, the behavior, sometimes the OCD. And I think a lot of times people don't even see behavior as OCD. I actually, when you taught us this in it was probably 2017. Because I've worked with little kids for my whole career. And I think back and I think, how many of these cases did I miss over time? Because, I would have probably seen a kid that came in like this and I would just do what I knew how to do. And I wouldn't necessarily think about it in this lens that we're talking about, where it's like multifaceted with medication, because that's not my scope, right? As a clinician, as an MFT, my scope has nothing to do with medication. But once I learned more about this, like I said, through doing my own research, my own experience with friends and family, I realized that sometimes that our job as the clinician is to give the resources, like go to your pediatrician and ask for this, and like do your own research and see if this fits for you. And sometimes parents are really afraid. Like they do the research and they read about the really scary situations and they're like, this is not my kid. I don't want this to be my kid. And then sometimes they feel really relieved and say, yes, this explains it. This fits for me. I think it's hard because I think there's so much we don't know. Like even what you were just describing about the few cases, there still seems to be some mystery, some pieces of the puzzle missing, right?
There are. And don't forget that a lot of these symptoms also can be normal in little kids. For example, like 3-year-olds are going to go arrange the pillows in your house the way that
Sure.
you had them at the beginning and not like when they're out of order. Is that OCD or is it not, right? Or when they line up their stuffed animals before they go to bed in a certain way. So it's when a lot of these things start really interfering with behavior, or when you have a child that was jumping out of the car excited to go to preschool and all of a sudden they are kicking and screaming and refuse to get out of the car. That is separation anxiety.
Right.
And yes, if you had a crazy day before and they didn't sleep and they ate too much sugar in the morning and a lot of other things were lined up, it could just be that they were having separation anxiety that morning when they're 3. But when these things continue and they're waking up at night and having a lot more frequent urination and all the different symptoms, and that's why PANS and PANDAS is more of a clinical diagnosis. And there are some great tools online now. There's the PANDAS Network. There's the PACE Foundation. There's the Stanford has a group, the Neuroimmune Center,
And the Arizona,
that's the PACE clinic.
Oh yeah, that's right.
And they have a lot of checklists too to help you figure out what is going on. And even tics, for example, like a lot of neurologists will say, oh, it's just a benign tic. And yes, a lot of times it is, and it will get better anyway when stress levels go down, when kids are healthy again. But then sometimes it's the beginning of a spiral and it can be something else. The other thing I find, unfortunately, is some kids, we will get them better. And typically I find it takes months to a year to really get better. And then they're good for a few years. And then they get another infection, another strep infection,
And it comes
or
back.
another mycoplasma infection. And then all of a sudden it comes back overnight. And as a parent, you're like always on high alert. And that's something we also didn't talk about, but in some of these cases, we may recommend getting the tonsils out if there are frequent strep cases or other infections. And when I talk to some ENTs, they will say, even if the tonsils look okay on the outside, when we do take them out, there's so much infection hidden under there that we didn't realize, and it's so close to the brain. Could that be why it's feeding this inflammation in the brain? And again, we don't really know, and you don't want to have kids have surgery if they don't need it. So that's sort of one of the issues. Yeah, it really depends on the situation. And so sometimes you're deciding between tonsils out or IVIG or other medications. And again, like often at that case, there are specialists involved, and I'm helping families navigate this, but it's not me making those, making those decisions.
But same with the tonsils. Like when I was a kid, I remember everyone got their tonsils out. If you got sick a couple times in a year, you got your tonsils out. Like my brother got his tonsils out. I remember it. It wasn't uncommon. And I'm imagining, that it probably the standards have changed, right, for care.
The pendulum is swinging back again. So you're right. Tonsils and even adenoids out were very common when we were younger, and I'm a lot older than you are. So. And then we went through a period where we didn't want to do surgery on kids. But now that we're back to seeing more infections, more issues with sleep, I am in my practice finding more kids for all sorts of reasons that do unfortunately need their tonsils and adenoids out because they have snoring, sleep apnea, recurrent infections. And again, I think a lot of this has to do with just the increase in illness and autoimmune and inflammation that we are seeing, whether it stems back from the gut microbiome, the COVID pandemic when we were all indoors and not exposed to things, and now we're all being exposed again. I don't really know,
Right.
But there are people a lot smarter than me that are working on trying to figure this out.
I think it's interesting about autoimmune diseases in general. I think that we don't know that much. I don't know that much about them. And I wonder how much we'll know in the next 10 years about what to do about it.
There also is, in kids with PANS and PANDAS, we often find that there's a parent that has an autoimmune condition, but sometimes the parents don't know yet, right?
Right.
Or there's some family history of a little bit, like they might say, oh yeah, dad had tics when he was younger and has celiac or rheumatoid arthritis. But that could be a setup, and there's so many genes and variants that we don't know about. In fact, I was recently at an autism genomics conference, again, because I'm always looking to learn new things to help my patients. And there is a lot that's passed on from parents to kids. But when you look at autism, we're also learning that half of the gene variants are actually de novo, which means they develop when parents are pregnant as well.
Oh, really?
So therefore, it doesn't always mean there's going to be a family history. And that's another whole area that, again, I'm trying to learn about, but it can also be overwhelming, as a pediatrician, how much time do you have? And often I'll refer my patients out to those who know more, but I have done some genomics testing from Intellect's DNA in my families that have PANS, PANDAS, autism, or other things that we're just trying to figure out.
Do you feel like it gets confused sometimes, like misdiagnosed? Those like PANS or autism or any other neurodivergence?
I mean, I think there can be a lot of overlap too. So it can be tricky.
Right. It could be both and.
Yeah. When I talk to autism specialists, which I am not, but those who see, a great portion of autism kids in their practice, they do feel that they see more PANS, PANDAS in the children with autism. And that can be tricky to diagnose.
Which one came first,
I don't know. I think in many cases you can see signs of autism younger, and then the PANS PANDAS might all of a sudden suddenly happen.
Right.
And again, that would be more of a developmental behavioral pediatrician that would probably refer to. And I did a podcast with Dr. Anshu Batra, who's amazing neurodevelopmental pediatrician in Westwood, and we were talking about this. It was a podcast where we talked about autism and leucovorin and some of the stuff that's been in the media recently and our thoughts on that. And, I defer to her on a lot of that since that's her specialty.
Yeah, I know. There's a lot of conversation about this subject, and it's hard because when we work with parents, usually parents just want to help their kids. That's it. End of story. Whatever it is. And sometimes the diagnosis is helpful, and sometimes it's really not. Sometimes it's just a name and just a label, but really people say to me, like, but what do I do about it? How do I just get my kid to not be suffering? Because that's what we don't want, right? The examples you gave and we've seen in our office, just kids suffering.
Yeah, and that is really hard. And, something that I try to help with, and I feel like as a pediatrician, I want to help and fix everybody, but that's not, always possible. So I'll just do my best. In terms of the diagnosis, you're right. In some cases, we just want to help the symptoms, and it doesn't matter what the diagnosis is. But in some cases, it can help guide us. And I talk about this a lot when I'm talking about ADHD. I do a lot of integrative ADHD in my practice. And I find that sometimes you do need that full neuropsych evaluation because there's a lot of overlap between ADHD and anxiety.
Exactly.
Or PTSD, and they're treated differently.
Right, and if you're treating the wrong one, it's not getting better.
It's not going to help.
Yeah.
And I find that, especially with ADHD, which I know isn't what we were necessarily talking about, but there are so many ways you can help kids with ADHD really succeed in school and life. And sometimes when they're not, I find it's because there's another diagnosis that's missing.
It's hiding. Maybe
and I want to take a step back and re-look at the evaluation and find out if there's something else going on there that we were missing.
No, I'd actually love to talk about that a little, if it's okay with you, because I think that you're right. I mean, we see this too. We treat in our intensive outpatient program, we treat depression and anxiety, right? But that can look like so many different things in how the kids present. And sometimes they come in, we think it's anxiety, but then the more we get to know it, it's actually turns out to be something more specific. Maybe it's an eating disorder. Maybe it's OCD.Maybe it's ADHD. And so much of our job ends up being the detective work, ruling out, trying to understand it, sending people to testing sometimes, because like you said, it's very helpful at times. And I would love to know more about your experience. Yeah, I don't know.
Yeah, I mean, and you mentioned the restrictive eating or eating disorders, and that's actually also can play a role with PANS and PANDAS,
that's
which
right.
we didn't mention. And again, that's not my expertise, but I actually share office space with Dr. Leslie Kaplan, who does specialize in eating disorders and ARFID and restrictive eating. So luckily, she can help my families when it comes to that. But that also can be a flag that there's something else you need to look for. But I agree, it can be hard to put the pieces together or to kind of figure out what's going on. And that's why I'm so thankful that I can spend more time with my families and also refer out to specialists, because I am not the best one to really differentiate always, is this ADHD, anxiety, PTSD, what is going on? But when I refer to the therapist, the psychologist I work with, the neuropsych specialist, they can help. And that's why I love having conversations. And I love that I have time to do that. And I'm so thankful when people like you call me and say, hey, I was just working with one of your families. Have you thought of this? And I'm like, oh, well, thank you for seeing it from a different lens and helping me take another look at how we could maybe, tackle their problems and try to help treat them.
Yeah, because we're looking at, like, I'm asking different questions than you're asking, probably, because I have a different scope. So I might get information that you may not get and vice versa. And I think for parents, like guiding them on what to look for, like the questions that I ask now are different than the questions I used to ask. I just have seen more things. So when someone calls and just says like, yeah, my child was doing just fine, in school and with friends, and then all of a sudden there was a change, my next question is always, have they been sick? When's the last time, they had an illness? And then, sometimes that's helpful and sometimes it's really not. Sometimes parents are like, I don't know. Why are you asking that? It feels random. It feels out of the conversation. And so I'll explain a little bit as to why. But I do think that there is, with kids, to see each kid as what they have and what they're showing and what they're struggling with. Like with ADHD, is it impacting them? Is it disrupting them? Or is it okay? Is it so far serving them? Because some kids do just fine with these symptoms and they still function.
If I leave, as long as I leave here at 11:30, I'll be okay. Yeah. Because it's at noon is my patient. So, okay. I didn't know if that was me, so it wasn't me. Okay, so maybe like 10 more minutes and then.
Okay. Okay. There's so much. I have so much to ask you. So, okay. What were we saying? We were talking about parents. Yeah, I know. I'm excited about that. Well, that's a whole nother subject, which is about babies, which I feel.
At any age, it's never too late to really start working on healthy lifestyle and nutrition and gut. And
why don't more people talk about that? That's what I want to know. Because, I had stomach issues my whole life. And turns out it was probably heavily anxiety related that I just didn't know because my family and myself, we were not in the world of knowing that anxiety can have somatic symptoms. And for me, it was stomach aches and still is at times where that's how I feel my stress. But I just wish more people knew about and talked about the gut and how important it is.
Yeah, I think there's also so much we don't know, right? So like sometimes I do gut microbiome testing on my patients. I use tinyhealth.com, which anyone can order. But again, we're still learning how to interpret it and what it means and what are the good gut bacteria. We know that for babies, Bifidobacteria infantis plays a big role, other bifidobacteria such as Breve and Longum. But then you not only need the good gut bacteria, but you need to feed them with the HMOs, the human milk oligosaccharides in breast milk, or the healthy fiber. And then as you get older, the gut diversifies. And so it changes. And, I think there's a lot we don't know. When I talk to some gut microbiome specialists, they will actually tell me, hey, by looking at a teenager or adult's gut, I can actually predict if they have any diseases, if they have inflammatory bowel disease. I talked to one guy.
The leaky gut, that's an indicator?
So leaky gut is a term that was used when there's increased permeability in the gut, which does have to do with some microbiome changes, but also just that certain things are passing through, which necessarily shouldn't, or there's a breakdown like in the lumen. And it's hard to test for. It's very complicated and complex. And I think we don't have a lot of definitive answers on that yet. Mm-hmm. So I think in general, taking a good quality probiotic, eating fermented foods, drinking kefir, eating kimchi, if you will, kombucha, high fiber cereals, lots of fruits, vegetables, those are all good. We know those are great. No one's going to argue with that. Okay. But when you get down to the nitty gritty of, what bacteria do you need and what level and how you should take them and are they going to stay put and colonize, I think that's where, we need more research. And so I think I think it's hard on a population level to give guidelines when there's still so much we don't know. But I think that's one of the great things about being a general pediatrician or general practitioner is that you look at every child differently. And it's not just protocols. And when a child has stomach pain, like you were saying, and you've already ruled out all the serious stuff, right? So you've made sure it's not inflammatory bowel disease and celiac and ulcers and reflux and H. pylori, then we can dive a little deeper into, some of these things and see if anything helps. But one of the other things that I sometimes see, and this sort of kills me, is that some practitioners go straight into the integrative holistic stuff. And then the kids get to me and I'm like, whoa, no one's ruled out the serious things and your child actually has something more serious going on.
Yeah.
So I think it is important to really look at all of it.
There's a balance between it all.
Yes. And I always say, I couldn't have practiced integrative medicine right out of residency. I needed that 15 years of really medical, serious,
to rule out the big stuff.
To be able to rule out the big stuff. And training at UCLA makes you realize how you can tell if kids are really have something real serious or not. I had a college student come into me last week complaining of gut issues. And honestly, my feeling was that even though I was going to do the whole workup, it was probably going to come out being stress, poor nutrition, some of the substances college students like to take, and that we really need to just work on nutrition supplements and gut microbiome. But we actually discovered that she might have inflammatory bowel disease, and she's getting a workup from a GI doctor. And so taking those first few steps to really rule out the serious things was really important.
Yeah.
Before we went on the other things, so you don't want to miss anything serious that does need treatment right away.
Yeah, I remember being very young and having to do a colonoscopy and endoscopy, and I remember it. I mean, it was terrible. I was a little kid. But yeah, it was that was them ruling out all the big stuff. Probably,
yeah, exactly.
And they concluded that, it was probably just anxiety, which it was. I mean, what I know now, working with kids totally was, but the somatic way that our bodies express it, sometimes people miss that.
Yeah, and we also didn't talk about the role that biofeedback or neurofeedback could also play, but there are other tools out there which I've anecdotally seen be very beneficial in my patients.
And again, the risk is low. I think when it's your kids, you don't want to take risks. So all the stuff that we're talking about today just has felt like, okay, well, what's the harm? It's always what I tell my friends. Like when my friends are like, what do you think about this and that? I always say, well, let's look at how could this hurt your kid? And then if there's real reasons, then maybe you have more caution. But if, like an Epsom salt bath is an example that I think is really low stakes.
Yes.
Like it really is not going to hurt.
I agree. And we do know that magnesium is important.
Yeah.
And when I've looked at gene variants in some of my patients with neurodevelopmental issues, I found they don't absorb magnesium through their gut. So in that case, a magnesium bath, which is relaxing, is a good nighttime routine. Anyway. Yeah. Exactly. And, and so sometimes I say, when is the science enough? Because it's going to take 10 years to 20 years to really solidify some of these things.
Exactly. And we're going to wait that 10 years.
But when there are a few studies there, when you do show that it has helped patients and it doesn't cause any harm, then yes, I feel like my role as a pediatrician is to keep looking and searching and trying things until I really feel like we've done everything we can to help this patient. And sometimes I search around the country and around the world too.
I know, and I so appreciate that about you. I think that's really special. And I hope that more people could, seek knowledge that way, because I think that's how we can help. And speaking of being a helper, and this is why we look for the helpers like you. And I guess lastly, what would you say to parents listening that maybe are worried about their child? What are the things they can do to look for, or who do they call? Where do they start?
I mean, I think starting with your pediatrician is really important. I know a lot of families, due to our crazy healthcare system, may not feel like they have a great relationship with their pediatrician, or they'll go once and if they don't like the answer, they'll jump to someone else. And I say, you actually want to keep going back and getting to know them, because it takes steps. They have to rule out some of the serious things and really work on it before they get to the point like, okay, now it's time to think outside the box. Mm-hmm. So please stick with your pediatrician, develop that relationship, keep going back. And then, hopefully they can refer you to mental health providers, but they can also look for mental health providers on their own. Mm-hmm. And that can play such a role in helping kids. I mean, we know how important that support is as well. and read and listen to podcasts like yours and keep searching, because parents, they will do anything to help their kids. And I've learned as a pediatrician, listen to parents.
Yes.
They're not crazy. They know what's going on.
Because no one cares about this kid more than their parent.
Exactly.
And I know when anything happens to my kids, it's like the mama bear comes out, I'm nice and friendly, but if you mess with my kids, it's different, like a different part of me, and when we work with parents and we see they're in distress, they're scared, they're not always the best version of themselves because they're just trying to survive and get their kid the help. And I respect it. But it is difficult sometimes because when people are in fear, they're struggling. So
yes, they are. And it can be disruptive for the entire family.
Exactly.
When the entire family isn't sleeping because the child is up running around the house all night long.
Of course.
Everybody suffers.
And then you spiral. Like, well, what, is this going to be forever? What does this mean? Is there something wrong? Like, are they going to be able to have a job? That's just the natural thing that parents do. So I just really appreciate you sharing what you know. And
what I don't know.
And what you don't know, because that's really real and vulnerable too. I think people need to remember that we don't know everything. I know that a lot of my friends and also clients, they want answers. And they say well, what do I do? Give me an exact protocol on what to do.
Yeah.
And it's really hard because there's not one size fits all because we're all so different. And so anyway, I just thank you for your time. And yes, we will have you back so you can talk more about the other many, many subjects we could talk about. We could probably have a couple episodes together.
Well, thank you so much for having me.